Coming up on Daytime, what you shouldn't do at the vet.
Because I frequently find, oh my God, my dog has pancreatitis, and they're like, it's going to cost me thousands of dollars. I don't even want to bring it in. And just bring your pet in because it probably doesn't have what you just read about.
Your veterinarian really wants to take excellent care of your pet, but sometimes pet owners can make that tough. Dr. Melissa Webster from Tampa Veterinary Hospital is here to share veterinarian pet peeves, which are rarely about the pet and mostly about, well, us, the pet parents. Great to have you here.
Thank you for having me.
Let's talk about the way people bring their kittens in.
Yes, loose like that. You can see how much trouble she's already in. That's why I brought the carrier. We kind of prefer that you bring your pet in a carrier because they're a little hard to sometimes hold. And then you may have a dog who's anxiously waiting to leap over there and touch the kitty. And that could be dangerous.
So am I always supposed to, I've seen people come in like this. Yeah. And dogs as well. And when you get all those dogs in the same room, it can be dangerous.
It is. It's dangerous for you. And I worry, you know, the cat may jump on your head, this dog may leap over and try and touch the cat, and that could be a whole fight.
Right, so have your dog or cat on a leash and have control.
Well, the cat in the carrier and have the dog on the leash, because frequently what happens is you know, he's fun with other dogs, but when you add him to the mix and he's nervous, I don't know what he's going to do, so having him on a leash, not the retractable that goes all the way across the lobby either, you know.
Right, make sure it's on the short setting. Right?
Yes.
Now, what about the collar around the dog's neck?
The collar, like today, I made this collar just only one finger tight because when it's two, he can back out of it. Okay. And, you know, being by a busy practice by downtown, I don't want my dog backing out of the collar as I'm coming in the practice.
Now, I've been guilty of this myself. When your animal is showing any kind of a symptom, you go online and suddenly you're a veterinarian yourself and you know exactly what's wrong. And you go in and you tell your vet, this is what's happening. Don't assume that you know, right? Just because you read it on the internet?
Yeah, Dr. Google is dangerous. Yeah, Dr. Google in veterinary medicine is quite dangerous. I see people come in tears and have themselves just all, you know, upset because they've gotten misinformation.
Right.
The kitten's just hilarious. You can't leave your necklace alone.
So what about credible, is there a place we can go for some credible information?
Yes, I think there are some excellent sites. Most of us as veterinarians have websites that have links that give valuable information, or we have information on our sites to help you. Because I frequently find, oh my God, my dog has pancreatitis, and they're like, it's going to cost me thousands of dollars. I don't even want to bring it in. And just bring your pet in because probably doesn't have what you just read about.
Right. What else are we doing wrong? What am I doing wrong right now? Why?
You're not doing anything wrong. I mean, you're playing with a kitten, but it's hard to pay attention and hold a kitten. And I mean, it's hard even when we're in the practice. Sometimes the pets are like all over the room bouncing around. This kitten's a riot. She's totally fun. You're doing nothing wrong. It's just, it's hard in a setting where they may be scared to make sure I can have predictable results for your pet.
I think she likes my necklace.
She loves your necklace.
Is it good?
She's a jeweler.
Is it? I guess when they take your dog back to do something with them, your first instinct as a pet parent is to go with them. But you would prefer probably...
Well, we usually ask, can we take your dog to treatment or your cat to treatment to draw blood, for instance, or do a certain treatment. We usually ask people because the biggest thing is, oh my God, they're taking it to the back. What are they doing in the back?
And really quickly, if you're bring your own pet. Don't send somebody else to take your pet in for you if you can. If you can,
it helps us a lot for communication.
Right.
Or if you do send somebody else, please be accessible on a cell phone or on your main phone so that we can have valuable conversations with pertinent information for you.
Dr. Webster, good stuff. Thank you.
Okay, thanks for having me.
Now she's calm. We'll be right back. What a good kid.